Okay, good morning, everybody. I hope everyone can hear me okay and that you can hear me okay online as well. Great. Okay, so welcome to this morning's event on ending the HIV epidemic in Europe. My name is Danielle Brady and I'm a policy analyst here at the European Policy Centre, working in the Social Europe and Wellbeing Programme and focusing primarily on health policy. I'm delighted to have you all in the room and also those who have joined us online this morning for this event. I'm very happy as well to be joined by some wonderful speakers also in the room and online. So I'm looking forward to what promises to be a very interesting discussion on the way forward with regards to HIV and ending the HIV epidemic in Europe. This is the final event of our project here at the EPC on ending the HIV epidemic in Europe. And the event is very kindly supported and sponsored by Gilead. We've been working on this project over the last number of months, and we started with having a roundtable discussion with a number of stakeholders where we got input and reflections on the topic. We then used this input to produce policy recommendations, myself and my colleague Elizabeth Kuiper, and we put together a discussion paper which will be available online today. So that's the basis or the background for this project. And what we found that despite the significant progress in recent years with regards to HIV remains a public health threat. We've seen that COVID-19 exacerbated challenges in disrupting healthcare services. And it's an ongoing issue. And with the Sustainable Development Goals, targets of 2030 really just around the corner as we approach 2024. Now is really a time, there's momentum, and it's a significant moment in which we can move towards meeting the goals. So as we approach the new Commission mandate and with the Parliament elections upcoming, HIV must be prioritised. The next legislative term will be of utmost significance when it comes to meeting the Sustainable Development Goals, given the fact that it will run until 2029, which is just on the cusp of the 2030 deadline. So there's a real opportunity here for Europe and the EU with member states to lead in the way when it comes to meeting the Sustainable Development Goals and eliminating the transmission of the virus. So it's in this context that we conducted the project here at the EPC and drafted the discussion paper that I have mentioned, which outlines some key policy recommendations on tackling the HIV epidemic and meeting the Sustainable Development Goals. The focus of those recommendations are really on the need for political will at the European level in particular, but also at the national level as well. The need to focus on prevention, testing, treatment and care, and to also address stigma and discrimination that is often associated with HIV. So with that, I'm going to bring my opening remarks to a close, and I'm going to pass the floor to my colleague Elizabeth, who will in more detail outline some of the recommendations that are contained within the paper.
Thank you so much, Danielle, and good morning, everyone. It's good to have you with us this morning. So my name is Elizabeth Kuiper. I'm Associate Director and Head of the Social Europe and Wellbeing Programme. And I'm really delighted that we're here this morning for such an important topic. Because as Danielle mentioned, indeed, we have been working together with our partner Gilead over the past couple of months to come up with very clear policy recommendations to ensure that the momentum for HIV, which we sometimes have been lacking over the past couple of years, will remain at the EU's political agenda. And I think that is very important also given the important moment in time we're in light of the EU elections, where especially if you're Brussels-based, you know that a lot of stakeholders are coming up with what I perhaps undiplomatically will call their shopping list with a lot of priorities. And again, I think this is really one of the topics that we should be focusing on and try to indeed maintain the momentum that is needed to indeed achieve the 2030 Sustainable Development Goals. And I think coming to the recommendations and also not wanting to take too much time, but I think it is important that you have in mind what we worked on the last couple of months. And I also really want to thank our stakeholders that have been working with us in the closed door roundtables to provide us with really useful suggestions, because when it comes to the EU level, we have come up with several recommendations, and no surprise in light of what Danielle just mentioned, that indeed the renewed political buy-in and commitment is really one of the first topics that we needed to mention as a concrete recommendation. Because one would argue that, especially in light of COVID-19, where it was so clear how important health is for our societies and even for our economies. So we need to really focus on health, but especially I think on HIV, there is a very clear case to make that when it comes to citizen participation, to the quality of life of people, indeed, we need to have healthy citizens. And this is an area where we actually see that prevention pays off. So in light of that, a second recommendation was to establish an EU-wide awareness campaign, because even perhaps for us in a room, having worked and working on the topic of HIV, it's almost a no-brainer to keep focusing on the topic. It's not so much the case at EU level, as we have argued, and therefore it's really important also when it comes to upcoming presidencies, and the current presidency that's holding the council, the presidency of the Council of the EU, which is the Spanish presidency, to continue focusing on the topic, but also stress the importance of a multi-stakeholder dialogue and a formal EU roadmap towards 2030. And I think it's really also important not just to have a campaign where indeed highlight the necessity of the topic being on a political agenda is one of the points taken forward, but also to create a dedicated HIV best practice platform and an EU guideline document. And the reason why that's so important is that healthcare systems across Europe are very different in form and shape, as we all know. And therefore, there is a big difference between member states. And it's really important to get on what is working in certain member states and what can other member states learn from that. So I think indeed having that best practice platform and also a guideline document that then set the standards so that others who are not there can achieve these standards is very important to again increase the momentum and the options available for people living with HIV. And I think a fourth recommendation about addressing the data gap stems very much from all of this, because it's quite appalling that even though I think there is a broader understanding, and I come to the European health data space in a bit, that of course, in a lot of treatment areas, data is of utmost importance. We need to have much more accurate data for effective planning and monitoring. So we need to have more standardized data collection, and we need to have much more reporting across EU member states. Because again, when it comes to achieving the SDGs by 2030, we see perhaps that the overall data are still somehow on track, and I'm sure that we're coming to that in the discussion, but there are big differences between EU member states, and we even see that data in some member states have been getting down, so the situation has been deteriorated. So therefore, within the European health data space, we need enhanced surveillance and research and a much bigger focus on getting the data that we need to improve the situation of people living with HIV. Another topic, and I think that also comes in very timely in light of the discussion about the EU's pharmaceutical strategy, is the importance of promoting research and innovation. Because we need, I think, in the first place, more sustained funding at EU level to support HIV research, but also we need to focus on new prevention methods and treatments. And I'm sure that also our partner Gilead has elements to say about it when it comes to the discussion later on, because we need to encourage funding mechanisms for implementation research on HIV treatment and tests, also emphasizing community-based approaches. And again, knowing that in the years to come, there will be a lot of discussion on the EU's pharmaceutical strategy, what it takes for the EU to advance on research and innovation. So this is a very specific point where I'm sure that also the European Parliament probably has suggestions to make about how we can do that in a meaningful way. So these are 5 very concrete recommendations from our paper focusing on the EU level. But of course, and given the differences between member states, it's also important to have more specific recommendations for the member state level. And the first that we started with is the importance of increasing investment in testing and innovation, testing and prevention, sorry for that. Because we know that we need diverse testing methods in various settings to enhance accessibility with a focus on key populations. It's really important also to expand testing services to include community-based, home, lay provider, routine, and emergency testing. So again, have diverse testing methods. And it's also very important to prioritize access to innovative accommodation, prevention tools, and PrEP. And I think we also come to that more specific element later on. Another element, which is very important also when it comes to the whole discussion about mental health, where luckily over the years there has been more attention for this topic, is the second recommendation at member state level to tackle stigma and discrimination. Because even in the 21st century, where one would hope that in member states there is an understanding of the importance of tackling stigma and discrimination, a much better and much more multifaceted approach to address stigma and discrimination is needed. Also there, the importance of accurate data on stigma comes in, because again, only if you have more accurate data, you can go for more targeted approaches. Because people living with HIV face a lot of stigma, and only when we address them, effective interventions can be built and developed. Also therefore, I think at national level, the collaboration between the different ministries involved, not just the Ministry of Health, but also, for example, the social ministry, the education ministry, is very, very important, because only, I think, a holistic approach can help tackle stigma and discrimination. I think a third one, which is very close to my heart, is the recommendation to engage with civil society and people living with HIV. Because only if we engage with people living with HIV, with patient organizations, with civil society, it will be possible to get also the relevant data to really ensure that indeed the right organizations that are working on the issues are involved, also when it comes to, for example, the EU-wide awareness campaign. It needs to start bottom up. So we need to know at member state level who is working on the topic in order to have a meaningful approach. And I think therefore also a platform like the Civil Society Forum that exists, and which in the past has been set up by the European Commission, but now is run by civil society itself, is really important in raising awareness and advocating for the different policy changes that we need. Again, I think a lot has been said of the importance of involving people with living with HIV in the design and implementation in initiative to drive sustainable change. And I think all of that indeed comes out very strongly from what you inputted in the project within the context of the closed settings that we discussed and that we used for indeed recommendations in this paper. So today I'm really looking forward indeed to how you think we can implement that, how we can drive the momentum, and how can we ensure that people living with HIV get the momentum they deserve.
Great. Thank you very much, Elizabeth, for presenting an overview of the recommendations. And likewise, I'm very much looking forward to the speakers' input now and their thoughts on the recommendations and how they see we should take this forward and the action needed, particularly at the European level. So therefore, I'll present you the panel who will be joining us this morning for this discussion. We will first be joined via video remarks from Francis Fitzgerald, a member of the European Parliament who couldn't be with us this morning, however sent some pre-recorded remarks. And we'll then move on to the panel discussion with those who are in the room with us here this morning and also joining us online. So member of European Parliament, Cyrus Engerer, very happy to have you with us this morning. Carlos Iniesta, who's joining us online, and he's the Research and Institutional Relations Coordinator at the Spanish Interdisciplinary AIDS Society. Joëlle Verluyten from the AIDS Clinical Society, who's with us here this morning. And Harriet, who joins us from the European AIDS Treatment Group, and also joining us online with a very nice background, I must say. Slightly envious as we look out at the very grey morning here in Brussels. So without further ado, we will now turn to the video from Francis Fitzgerald, member of European Parliament. And pardon, I also forgot to introduce Felipe, who's just sitting here beside me from Gilead. Apologies for that. Felipe is Executive Director of Medical Affairs, HIV, and Gilead. Do accept my apologies. But we'll now move on to the video.
Good morning, everyone, and apologies I cannot be with you all today for this important event. I particularly want to thank the European Policy Centre for inviting me here today, and I want to congratulate them for all the important work they are doing. Also, a moment of appreciation for those speaking here today. Allow me to thank them for their contribution to eradicating the scourge of HIV in the European Union. In 2020, we were taken by surprise with the COVID pandemic. Personally, it brought back sad memories of the HIV/AIDS epidemic in the 1980s and the terrible fear and stigma that surrounded that time. I was a social worker in London then, and I remember the uncertainty. There was very little understanding of why people were sick and dying, no real treatment available. And coupled with all of that, the dreadful social stigma that was attached to the illness. Upon reflection, the COVID pandemic reminded us of the lessons we had learned in the 1980s. The importance of prevention, treatment and research when it comes to treating serious illness. Fortunately, nowadays, of course, a HIV diagnosis does not mean your life is over. Thanks to significant research, there is now treatment to keep HIV at bay. Not only have mortality rates massively dropped since the 80s, but there are new drug therapies which prevent passing the disease to someone else. In addition, the social stigma that the disease once carried is certainly decreasing. And the outlook for those diagnosed, very importantly, with HIV is far from bleak. However, there is still work to be done. In 2021, when we had our eyes glued on COVID, HIV and AIDS killed 650,000 people worldwide. This is one life lost to the virus globally per minute on average. So to tackle this ongoing epidemic, we must always be focused on prevention. And for that, PrEP is one of the biggest tools. I applaud Gilead Sciences for their work with this groundbreaking drug. European countries must make efforts in this area, ensuring that PrEP is available to the 500,000 citizens for whom it is still completely out of reach. As we did with COVID-19 vaccines, I encourage the EU to seek the bulk purchase of PrEP, therefore reducing the costs for individual member states and citizens. Currently, it can be bought in some member states for €5, while it can cost thousands in others. In levelling the playing field, we must also ensure that PrEP reaches the entire diversity of our population who seek it, not just one or other societal group. To make sure that we reach our 2030 targets, UNAIDS released the Global AIDS Strategy 2021 to 2026. There has been progress towards these targets, but looking at the data from 2022, it is unbelievably likely that most EU member states will fall short. While existing HIV prevention and treatment services have been effective, they must be scaled up to prevent further infections and AIDS-related deaths. The essential work of the European Centre for Disease Control in continuing to track and monitor the prevalence of HIV in Europe will be crucial to our efforts to counteract HIV into the future. Yet as we tackle the physical health of those living with HIV, we must also reflect on the social consequences. The discrimination and stigma that still exists. It may sound unbelievable after decades of information campaigns, but there is still a lot of disinformation out there, especially among younger generations who did not go through the toughest years of the epidemic. We saw during COVID how easily false information and rumours can spread about health-related issues. So the EU has to put great efforts into combating false information, while of course promoting verifiable and expert-backed knowledge to the public. We must continue to do so. We continue to live in a time of huge crisis, and sometimes it seems that a new one emerges every day. However, each new crisis usually doesn't just require a response today, but will need continued attention for many decades. We've learned that. Nowhere is this more true than when it comes to tackling HIV. In the European Union, we are committed to ending the HIV epidemic by 2030. Imagine achieving that. I believe that with a concerted effort and renewed political focus, we can meet this deadline and confine one epidemic to history. So thank you again for inviting me to be here with you today.
Great, and just to say thank you to Francis Fitzgerald, Member of European Parliament, for those remarks. which I think she touched on some startling statistics as well when it comes to the number of lives lost globally to HIV. And something she mentioned there, and Cyrus, I want to come to you to pick up on this point, is the need for renewed political focus. This is something we've talked about in the paper, the need for renewed political buy-in and commitment to end the HIV epidemic and to meet those sustainable development goals by 2030. So it'd be good to get your opinion on how you think that this could be achieved, and indeed what the role of the European Parliament is in achieving those aims.
Thank you, Danielle, and thank you everyone for being here and for the invite today. It's an important topic which sometimes I feel is only discussed at this time of year, when we should be discussing this daily throughout the whole political year, and not just when World AIDS Day would be coming close. Last July, I was in New York at the United Nations discussing the Sustainable Development Goals. And it's very clear we're midway through in the timeline. However, we're far away from reaching any of the sustainable goals that we as a global community have put on ourselves to reach. And one of these, obviously, is Goal 3.3, which speaks on HIV and AIDS. And as Francis just said before me, even us as a European Union have that commitment to end the HIV epidemic by 2030. However, I do not need to go into the numbers. We all know where we are. We all know what the current situation is on the ground in the different member states of the European Union and globally. I myself come from a country that has the highest increase of HIV new cases every year. And that is something which I cannot believe that we're at that at this moment in time, given all the information that we have, given all the research that has been done, given the technological advances in medicine like PrEP and PEP. But then when I look at society, and I'm going to speak about my society, I start understanding why we're still where we are. A conservative country that has made great strides when it comes to the LGBTIQ rights and community. We were the worst 10 years ago in Europe, among the worst, let's say, the laggards. And now we're the #1 when it comes to the ILGA Europe rainbow map. And as a gay person myself, I always saw that we needed to work on rights, but at the same time, we needed to also work on education, on information, and on funding more research. And it is, I think, there that we really need to put our minds and political minds at work in order to make sure that things start changing and start changing now. I can discuss all of Europe, and we could, but I'll focus slightly a bit about my country, knowing it best, but also seeing the opposite of what should be done. And therefore, we actually need to learn also from, well, we could learn from the best practices when it comes to rights, but then also learn from the worst practices, let's say, when it comes to sexual and reproductive health and rights in my country. So one of the major issues that I find is, firstly, research in Europe and in my country. When comparing the United States to Europe, Europe lags behind when it comes to funding research for medicine, pharmaceuticals, science in general. That is one of our biggest challenges, and it is something that we need to address also in the pharmaceutical strategy. So I would put that at #1. Secondly, different member states have different outlooks as to how to educate the young and the older generations. My country, for instance, lacks comprehensive sexuality education strategy. Till today, it does not exist. It's inexistent. And obviously, we see the highest rates, for instance, of teenage pregnancies. We see the highest rates in Europe of new HIV cases per year. and a whole lot of other sexually transmitted diseases. So that is another area where we need to focus. Thirdly, we need to make sure that the prevention systems work. I remember 15 years ago when my party was still in opposition, campaigning in the streets, in front of our clinics, protesting in front of our hospital because there was a waiting time of 6 months to get an appointment to test yourself for HIV and other STDs at the public health center. Fast forward 15 years, 10 years ago, my party won government. We made a revolution when it comes to LGBTIQ rights and other civil liberties in general. But then, when it comes to the waiting time for a test, it has been confirmed last week that it's still 6 months. So 15 years ago, it was 6 months. Today, it is still 6 months. And I think, and from what I hear from the meetings I have with people across Europe, this is a common trend that unless you are able to pay good money sometimes to test yourself, you cannot find free testing in urgency in our public clinics and hospitals across Europe. And this is another major challenge that we have and that we need to address. Then I would move on to the issues of minorities in our society. And the fact that many a times they are not given a voice to speak out. Last year, I held a conference in the European Parliament building and gave European parliamentarian seats to people who are usually left outside. I held this conference with nobody left outside, and we invited, amongst others, an HIV positive person from Ukraine who described his situation before the war and after the war, which I mean is different, but wasn't that much different when it comes to access to healthcare. Obviously, the war made things only worse, but the reality is that HIV people across Europe, especially those coming from minorities, are often left outside of the system, the health system, and we really need to tackle this. I'm speaking here of refugees, asylum seekers, migrants in general, sex workers, the trans community, LGBTIQ people in general, other minorities, ethnic minorities in our countries, many a times are left outside or feel that they are left outside of the whole health system. And we need to tackle that as well. And we need to make sure that in our strategies and our policies, we have comprehensive, inclusive policies that make sure that everyone is integrated in the system, in testing, etc. Finally, I will move a bit onto the pharmaceutical strategy. I think that we're at a crossroads in Europe. We're reeling out of a pandemic, which came after maybe 100 years from the previous major, let's say, pandemic. And I hope that this has made us learn some lessons. Funnily enough, sometimes, although maybe funny is the wrong word because it's sad, when you speak to different governments across Europe and speak about preparing ourselves for the eventuality of a future pandemic, the next pandemic, who knows when it would be, but knowing and judging with the way climate is changing, with the permafrost melting, etc., we know that this could be, hopefully not, but it could be something which is closer than we might think. And therefore, we need to be prepared. Our systems need to be prepared for that. But when you look at the pharmaceutical strategy, I think that we need to, as I said before, firstly, invest more in research and innovation in Europe. And secondly, I know that this might not sound the most exciting thing for pharmaceutical companies, but I agree totally with Frances Fitzgerald when she mentioned the lesson from COVID and the joint procurement of medicinals in the European Union. I come from the country which is the smallest country in Europe, which is at the periphery of the European Union. And our reality is that we have the least access to medicine in general when it comes to different medicines and therapies, etc. And we have the highest, most expensive rates of medicine in Europe. And this is something which cannot keep on happening. We're speaking of, we always speak of one single market. We always speak of our single market, which is one of the biggest achievements of the European Union. But when it comes to medicine, we're still speaking of 27 different markets, small markets, big markets, etc. But in reality, we need to make sure that even when it comes to pharmaceuticals, we need to have one market, and that can be done with this pharmaceutical strategy if we actually push forward the legislation that we need, including, for instance, parallel trading, which is of utmost importance, which includes joint procurement, not necessarily in the way that we did during COVID, but that could be as an example. We could have regional joint procurement. We could enhance the way that we have cross-border wholesalers, for instance, which are very much important in order to make sure that medicine arrives to patients across the European Union at affordable prices everywhere. We need more transparency to have that, etc. I know that in my country, for instance, to buy PrEP, it's very expensive. You can many a times buy it online in London, for instance, get it at a much cheaper rate, and then have it sent to Malta by post, which is something that a number of people that I know actually do. But should it be that way? Should access be so difficult in today's realities? Do I need to create an address in the United Kingdom or anywhere else to have pills that I need being sent to that address and then sent to myself in another, fine, not a European Union country, we're speaking of the UK, but in another European country. And this is something that we need to tackle. Government, in my case, has promised not only the last election, but also the election before, that it would introduce PrEP-free for everyone and PrEP-free for everyone, but unfortunately, it hasn't done so yet, notwithstanding the fact that a whole mandate passed, and now we're the second mandate with the same promise. I will end here, but I think that what I would push for mostly, apart from research, which will always remain important for even more technological advances, even maybe in the future better than PrEP and PEP, to move towards comprehensive sexuality education, because I believe that education ultimately is the key to end this epidemic in the next 7 years.
Thank you very much for those remarks and for those points that you've raised about the action that is needed to tackle HIV and ending the epidemic. And you mentioned quite a number of times the importance of prevention. And I think, Carlos, turning to you now and coming from the Spanish context, of course, the Spanish presidency have also placed HIV on the agenda and have prioritized it to a certain degree. But working in the Spanish context and reflecting on your own work and the ongoing efforts in Spain to tackle HIV, with regard to prevention in particular, what action do you see is needed to decrease the transmission of HIV?
Yeah, so thank you all. Thank you, Danielle. Thank you, Elizabeth, for the amazing introduction. Also, Cyrus for his amazing speech. And thank you for allowing me to participate in this very interesting meeting to share my reflections, as you said, on how we can improve HIV prevention from my experience here in Spain. I'm afraid I will not offer very different insights than those included in the discussion paper or that Elizabeth has also shared before, because I think they collect very clearly what needs to be done, but I try to go deeper in some points. And as mentioned before, Europe as a whole and also Spain have met the 1990 targets, but we're still far from the goal of reducing new infections by 25%, which was also a goal compared to those in 2010. This, for the case of Spain, could have meant that we should have had around 1,000 new cases of HIV by 2020, while we were having around 4,000. It is true that this figure is reducing now, but it is still far to achieve this goal. And this is why preventive measures are so important, and especially PrEP, because PrEP can be a game changer, as we are seeing in cities like London or Amsterdam, with a promising figure of only 9 persons infected with HIV in the last year. And this is why I'm going to focus my intervention mostly on PrEP, and I'm happy to see that Frances Fitzgerald was also giving PrEP this importance in terms of HIV prevention. So as I was saying, PrEP can make the difference, and PrEP is available in my country free of charge since 2019. But there are a few things that we need to bear in mind to be sure that it reaches its full potential. And the first point I want to talk about is, of course, stigma and discrimination. HIV and PrEP-related stigma is a crucial factor that we must keep in mind, because same as for HIV, it relates with each and every aspect of PrEP and with many of the topics I will bring up later. And not only stigma associated more directly with PrEP or HIV, but all forms of stigma and discrimination against minorities, such as homophobia, transphobia, xenophobia, misogyny. All of these are cross-cutting issues in the response to HIV. So this is the first remark I would like to make. We must address all forms of stigma and discrimination to tackle HIV from a perspective of prevention. And of course, having political supports in this regard is crucial, as it is happening right now with the Spanish presidency fighting against HIV-related stigma. But this doesn't always happen. So I would say that another important aspect is to always have strong and lively networks among the community, healthcare and public health professionals, scientific societies, as the one I work for, and also politicians, whether they are in power or not. Because these networks, when they work, have a huge agency. So whenever governments are aligned, they can provide amazing support. But if they're not, they can also take action themselves. So this would be my second remark: fostering collaborating networks among all stakeholders. My third point, not talking now more directly about PrEP, is that we need to bring PrEP closer to all the populations that could benefit from it, and that we are not reaching at the moment, other than gay, bisexual, and men who have sex with men. In Spain, for example, 1/3 of new HIV infections are among women, but only 2% of PrEP users are women. And we are not reaching either transgender populations, for example. So we need to increase PrEP access among them. And this brings me to my third, to my following point, which is that we must make PrEP care models more flexible and centered in people's needs. PrEP has proven to be cost-effective, but it is true that the current follow-up recommendations with visits every 3 months lead to a high workload for healthcare professionals, long waiting lists, and it can also be a burden for PrEP users, who often have to go more than 6 times a year to a healthcare facility. And many times it happens to be that PrEP users go more often to hospitals than people living with HIV, which is a bit paradoxical. And additionally, in Spain, PrEP programs are mainly located in hospitals. These resources are expensive for the system, and they not always have the best cultural competencies to address potential PrEP users' needs. So how can we improve this? How can we make PrEP programs more accessible and more sustainable as well? Well, first, I would say encouraging the participation of community-based organizations in PrEP programs. We have some good examples in Spain for HIV care, and maybe to a less extent, but also for PrEP care. And we need to scale up these models, because community organizations could address better the more psychosocial aspects related to PrEP, such as stigma. A second important point, I think, is increasing the involvement of primary care. At the moment, primary care is barely not involved in PrEP in any of these stages, and I think this would be key here. But not only for PrEP, I would say we need to involve primary care for sexual health care in general, offering testing, promoting preventive methods, and linking to specific programs when necessary. And I also believe that these 2 points, involving community-based organizations and primary care, could also help us to face one of the major challenges we have ahead, that is responding to the STIs, to the increase of other STIs other than HIV. Another way to improve accessibility and sustainability of PrEP programs, I would say, thinking about the recommendations on follow-up, would be spacing out visits. Maybe 4 follow-up visits a year is a little too much. We need to identify patients who could self-manage better and making them more self-responsible for their care through, for example, self-sampling. Another key point based on the existing evidence would be maybe authorizing the use of PrEP on demand. Currently, this regimen is not approved by EMA, and the way it is, I don't think pharma companies would take the initiative to ask for its approval, but the evidence is there. Sexual life is not constant over time, and so prevention measures shouldn't be that rigid. So even though EMA has not authorized on-demand PrEP, I think we have some examples, like in France, where the on-demand PrEP is being prescribed that must be followed. Finally, we must be prepared to fund new forms of PrEP, such as long-acting PrEP. Here, of course, companies must make an important effort to offer a reasonable price, but also health systems must do the price to fund these new forms of PrEP, understanding that it is not a measure for everyone, but for those people who may need it, such as people with adherent problems or people with a greater stigma associated with PrEP use. Well, I'm finishing now. In Spain, there are already about 20,000 people on PrEP now, and that will certainly have an effect on the number of new infections that we will be able to see in the upcoming years. But it has already had a positive effect on the reduction of undiagnosed cases, which have halved in the recent years. We used to have 12% of people living with HIV undiagnosed, and now, thanks to PrEP programs, we only have 6% of people living with HIV undiagnosed. So, well, my final point would be that having comprehensive sexual health care programs free of stigma, where we can do testing and, depending on the result, offering treatment or preventive measures that fit people's needs is fundamental. And I think this is the way forward for us in the future. I think I will leave it here for now, and I will be happy to talk further about any of these things in the Q&A turn. Thank you for your attention.
Thank you so much, Carlos, for reflecting on the importance of prevention, in particular PrEP. And you mentioned there as well the importance of comprehensive health programs. And I suppose, as important as prevention is, also increasing knowledge and awareness of it is vital. And with that, Joëlle, I'll turn to you, because healthcare professionals play quite a role in this, in increasing awareness, knowledge and understanding of HIV and the importance of testing and prevention. But it'd be good to get your insight into how you see the role of clinicians in this, and the action needed to ensure that clinicians are also equipped with the necessary skills and knowledge in order to do this.
Well, first of all, thank you for the invitation and inviting AAX and for the clinicians to have a voice. So I think Cyrus and Carlos addressed a lot of the issues that we all work on. So what I'd like to talk about is what AAX is doing, which aligns with your recommendations with how we can further develop this. So because ending the HIV epidemic is at the core of our mission. So I think that's what we all aim at. So we have an education and training program at AAX, where we have a medical exchange program for young clinicians, where they can go in different clinics and learn from other clinicians. So we have different expert clinics in Europe, and we send younger clinicians, because the aim is really to engage younger clinicians in HIV care and in HIV management. We also have a career development fellowship program, where we have a mentor and a younger clinician, which, I mean, for the younger clinician, for example, is working on their PhD or an abstract, and they have a mentor from one of our centers. We call them an AAX clinical centers, and they follow them for a year. So because I think we need, before addressing the research, I mean, for the research gaps, we do need funding as well, of course, but we also need to train younger clinicians and encourage them to be interested in doing research. We also have an HIV summer school where we have a research program module and a clinical module for the management of HIV, and where we invite young clinicians from all over the world because viruses have no boundaries. So we don't just limit ourselves at the EU level. We try to have an outreach in the European continent, and with that, we are developing at the moment the HIV diploma in HIV medicine, which will be the overarching program, diploma for all of our courses, because all our courses will depend on this diploma, which we hope to launch at the end of next year. We also have the AIAX guidelines, which we publish every year, which are recommendations for HIV management for people living with HIV. And we also have the standards of care program, where at the moment we're working with ECDC on standards of on European standards of HIV care in Europe, where we are aiming at defining standards in HIV prevention and care along the care continuum pathway with related quality statements and measurable and auditable outcomes. And we will develop a tool which can be used to audit and implement defined standards at national, clinical, and community level. And in this project, we aim to develop 8 to 10 standards over the next 4 years. And we've started with the PrEP module and the HIV testing module, which are developing this year. And we hope to have 2 audits next year over in Europe. So these are tools that we're working on HIV testing and some of the outcomes, because when HIV testing, there's also combination testing as well. And for PrEP, access to PrEP, which is a prevention tool also, and some countries in the world do not even have access to PrEP. So that's so we will develop these standards. And so then there's another aspect we're working on also in standards of care, which is on stigma. So we have launched a survey on stigma in healthcare settings, and the stigma is being this survey is now ongoing all over Europe. I'm talking Europe as a whole, not just the EU, and it will be closed at the end of November, and it's accessible to all healthcare workers. So, and this is through our networks that we have built on, and it's been quite successful at the moment. So we have a good response rate, and it's a follow-up on the survey that ECDC did with the community last year, where there's a report on. And as for standards of care, I think it could be important also because AIAX did write an opinion piece that was published in the AIDS journal in November. So if you're interested, you can learn more about what AIAX, the opinion of AIAX on standards of care and the development of having HIV care and in Europe. So you spoke about dedicated HIV best practice platforms. So I think that's important. There are already a lot of documentation on different platforms. I think it'd be good to have everything on one platform because everybody's doing their own thing at different levels. So we can put everything together. So to address the data gap, we do need the data gap. Also, for example, talking about PrEP and women, there is no data on women. We have a women's group that wanted to do a paper on PrEP, and there is no data available. So how do we develop that? How can we address that? That's a question as well, because there's no research on women. And I think so it's important to promote research as well, and as I said, through engaging our younger clinicians, because they're the next generation. As the first speaker from the European Union said, I mean, we were at the beginning in the 80s, at the beginning of the pandemic, and now the younger clinicians may not be as interested because the older generation now is retiring. So we really need to have younger clinicians engaged as well and be interested in HIV as a whole. So in conclusion, what I would like to say is that we have to reinforce the pivotal role of clinicians in achieving the sustainable goals of developing and ending the HIV epidemic in Europe, encourage ongoing collaborations between clinicians and the civil society, policymakers, and even the pharmaceutical companies, because it's only together that we can build on things. We already do this also through capacity building project with ECDC, where we do capacity building courses for policymakers, but also for where we engage the civil society on how to teach them how to use the different tools to extract the data so they can go to their policymakers about it, and then urge clinicians to stay informed, engaged, and committed to the cause of HIV. That's as a whole. So.
Thank you very much. And it's great to get the clinicians' perspective on this as well, because as you mentioned, it's a multi stakeholder approach that's required, be it with clinicians, with people living with HIV, as was mentioned earlier, and also with industry, of course, which play a very important role. So Felipe, I'll turn to you now to reflect on that. And in the paper, we discuss the need to promote research and innovation, which I think was touched upon many times this morning by the other speakers, but we really get to get your opinion from the industry perspective on the action that is needed to do this, and the role that the EU can play in this. So I'll hand the floor over to you.
Wonderful. Thanks, Danielle. It's a pleasure to be here with so many like-minded people and hear the different perspectives. So for me, there's a lot of learnings that I'm taking notes of things that either we need to do, we need to start thinking of. Some of these things we started doing already, acknowledge the comment about gaps in data sets on women and so on. There are some regulatory bits that are harder for us, but hopefully we can work together. And from the kind of political side, you can help us influence the regulatory environment as well. So about myself, I come from a clinical background. I'm an ID physician trained. I work for Gilead Sciences in the global medical team. I'm based in the UK. Again, I'm representing Gilead here. So I'll talk a little bit about our views of innovation, what we're here for, but also the things that we can do together. And there's a lot that we can do together because I think our common goal is end the HIV epidemic. So when I was putting my bullet points together here, I think that the first one was to be a bit positive and celebratory, aligned with what Francis said in the beginning, because we need to acknowledge that we've come far. I mean, it's 40 years we moved on from HIV as a death sentence to a condition that is chronic, that people have near kind of normal lifespans compared to people that are not living with HIV. But with that said, it's not enough. There's still a lot to be done here. And again, if you think about issues that came up, stigma, mental health, and some of these things that you all have touched, I think this is again, we're far off compared to what our goal should be. Even if you think about the cascade of care, the cascades that we see across the different countries in Europe, and we have a handful of countries that they have reached the 95, 95, 95. Again, it's a great example in talking about the best practice sharing and what can be implemented or transported to other countries. This is something that is extremely valid, but in the worst practice sharing, as Cyrus said, I think is quite important of what not to do. But I think, again, even though we have those examples, some of the markers or more sustainable kind of steps like stigma and zero stigma, that is part of our goals. We're far off. So again, on the easier to reach, we can get there, but I think some others, they require a little bit more work, like stigma. And of course, the other side of the cascade of care and the cascade of prevention, which you also expect 95% of people at risk to have access to combination prevention. And this is really not happening. If you think about countries that they are probably more advanced, if we have 10 to 15% access to prevention, I think that is a good number, because across Europe, we are not there yet. So there's a lot to be done, a lot to improve upon. I think we need to acknowledge the differences if you compare Eastern and Western Europe, or even North and South, when you talk about prevention, mainly related to their economical reasons, but also their kind of political, religious, conservative reasons why people decide to not invest in HIV or not keep HIV in the political agenda. I think, again, the challenge starts now if you think about how we can reach those at need and why innovation is so important. So if you think about this kind of the 555 that are left from the 95s, I think that's where we have more work to be done. There's again these groups, they're hidden. We're often talking about migrants, asylum seekers, people that are completely detached from the healthcare system, and there's a lot of work that needs to be done to reach those individuals. So with that said, I think as a region, I think we are probably very kind of fortunate that we are on the right path to get to the end of the epidemic ahead of others. Of course, trying to address those challenges that, again, there's work to be done, but all possible. One of the things that we are talking about here a lot is around prevention. And again, probably focusing on that a bit more. Again, PrEP is here. PrEP is widely available in some countries, but with an uptake that is suboptimal. And that seems that there's something wrong with that. Even if you think about countries that, okay, drug is for free, there's broad access to testing for HIV and STIs, we still have this kind of very, very kind of tiny penetration for those individuals at risk. So I think this talks about the need for innovation and options, because it's all about options. So there's no one size fits all. There's not a single option being daily pill or long-acting injectable every X months here or there, 2 months or 6 months. Eventually, hopefully, we'll get there. But again, all these need to be offered according to individual needs here and there. And that's where we're heading to. Hopefully, also bringing data on those populations that we often don't see represented in clinical trials. I really like the mention that Elizabeth has done for implementation science, because it's very, very important for us in the industry to understand how drugs are going to perform in real life, because clinical trials are a very artificial setting. And I think over time we are moving towards how things are going to work for people that they may not have good adherence, they may not have the ideal housing conditions, or they may feel kind of extreme stigma towards them, kind of because they are close to family that's very conservative, or they have a house share or flat share that they cannot keep their tablets visible to people that they cohabit with. So these are the things that need to take into account. But I think, again, back to what I mentioned about options, I think that's a key part, because we've gone a long way. Treatments, they got a lot better. Now we're talking about simple one tablet once a day, minimum adverse events, but it can still be quite disruptive. So when you think about individual and their lives, it's important to talk about a people-centric approach, because we moved on from HIV 40 years ago and how many months people can live, to think about having an optimal CD4 or immunologic system to then keep HIV suppressed, and the viral load marker, which is very important because that brings the concept of people that are undetectable being untransmittable. So that does improve people's quality of life, of course. But I think we need to give one step further, that is understanding concepts of quality of life, people's preferences and satisfaction. And of course, again, and that's why the concept of patient-reported outcomes for us, it's quite important. And we think that this is the mark that should be added to clinical trials if you think about bringing innovation or novel options to those impacted by HIV, either at risk of acquiring HIV or people living with HIV. So one thing about Gilead is that we have 3 big pillars that we work on. Innovation is a big one. That's the clear kind of what people expect from pharma. 95% of the investment in HIV for innovation comes from pharma. So innovation is a big one. But we do acknowledge the importance of ensuring that we have the innovation going to people and ensuring access. This is something that we are very committed to, and we are hearing all your insights and your feedback. For us, this is something that we need to bring internally and work towards to not have any kind of blocks or any hurdles for access. And and also the partnership with societies, organizations, working with EATG, working with EACS, because again, I think our individual voices in isolation, we may not get far, but when we work together, I think that help us all get to the end of the epidemic for everyone, everywhere. So I'll stop here and hopefully we can have a discussion in the end.
Thank you very much for highlighting all of that, and something you mentioned, and I think almost 100% sure every speaker has mentioned it in their intervention so far, is the importance of stigma and ending stigma, obviously, and discrimination. And with that, I'm going to move on to Harriet, and to ask you perhaps to delve a little bit more into that, to the need to tackle stigma and discrimination in any attempt to eliminate or end the HIV epidemic in Europe. So I'll pass the floor over to you to reflect on that a little bit more.
Yeah, thank you very much, Danielle, and thanks to everyone in the room and online. Someone mentioned it before, very much like-minded people, and with regards to the time, I will try to keep myself short. However, I want to introduce myself. I'm a sexologist. I'm based in Cologne. What you see behind me, you mentioned it before, is the River Rhine. So I'm based in Cologne, which sometimes is regarded as one happy island when it comes, for example, to PrEP. And as a sexologist, I'm representing EATG here because I'm the chair of the combination prevention program of EATG. The name combination prevention has been heard quite a few times while I was listening, and I think it's very important to acknowledge that this stands for an integrated and holistic approach that includes sexual health, which helps us to understand much better and to embed much better any prevention methods in our aims towards the SDGs. I want to limit myself to highlight two aspects out of what we have already heard. And one is, I mentioned it already, is PrEP. We have heard that access to PrEP is crucial, and I absolutely agree. And most of you know that, especially for women, PrEP is not as accessible as it should be, mainly because women just don't know that it exists. Talking about Cologne, if I go downtown Cologne into the pedestrian zone and talk randomly to people about PrEP, MSM gay men will know how to explain to me how PrEP works and where to get PrEP. And if I ask women who are definitely at risk, they wouldn't even know that it exists. So the access to PrEP strongly is connected to knowing about PrEP, and is strongly also connected to the possibility of having tests offered and the possibilities of testing oneself for sexually transmitted infections would help spreading the word about the existence of PrEP and the accessibility. The other point I really want to stress is stigma. We've heard a lot about this, but stigma does not just fall from heaven. It is built up by societies, it is built up by legislation. And I'm not only referring to the stigma that comes to people living with HIV, which is still a huge issue, even in Germany and all over Europe in healthcare settings, which is the first situation when I'm being diagnosed, where I learn how people are dealing with this diagnosis. And if healthcare professionals already transport the stigma, then it's very hard for me to withstand this. But talking about stigma, I think, and looking about the European region, it is very important for me to address that there is still huge criminalization going on. Please think of me with the issue of sex work, where we still have this ongoing criminalization efforts of people trying to criminalize sex work. The same is the case when it comes to the use of drugs. So what we need, and talking about the communities here, what communities need, communities that are at risk, is a legal framework that empowers them and not diminishes their possibilities. So I promise to make it short, and my last sum up or wrap up is, please consider the communities that I'm representing here. And this is not only the communities of people living with HIV, but also the communities you have been speaking about. And I just want to name them once again. It's the MSM communities, the LGBTQI communities, the sex work communities, communities of mobile population, migration, ethnic minorities, trans people, drug users, and please consider our communities part of the solution. And then I can sum up that I'm very much in line with the paper that I have read and the words that have been spoken so far. Thank you.
Thank you very much, Harriet, and couldn't agree more of the importance of including all those different groups that you have listed, and the need to involve these people as we move forward and try to put these recommendations into action. And perhaps picking up on that and the need for inclusion, and based on what Joëlle and Felipe and also yourself have mentioned. And let's maybe just to ask you your thoughts on this, on the importance of including other groups. And one massive group that was mentioned was women. As well, I know it's something as we work together that we discuss quite a bit is women's health and the importance of including women in clinical trials, etc. So just to get your thoughts on that and what action you think is needed and could be done to include them more in just the discussion and in action.
Well, thank you very much, Danielle, for that question. I think it's a very, very relevant point, because indeed, during the presentations this morning, and I think perhaps you, Joëlle, mentioned also a very important point, that when it comes, for example, to PrEP and women, if there's no data, there's no idea about treatment, there's no idea about stigma, there's no idea how to involvement, indeed, also perhaps in ideas about innovation for the different stakeholders involved. I think, Felipe, you mentioned, for example, the fact that apart from clinical trials, where I think also indeed the topic of women's health comes in, because I think also there it is important that women get included, that we have more data available about to what extent women are already included. And I take it from what I've read that it's not so high. So then I think it makes up for a more specific approach if more women were to be included. But certainly, because the setup of clinical trials, and I think you alluded to it, Felipe, has shortcomings, because it's in a clinical setting, and therefore you need real world data. And I think all of that really, for me, comes to the recommendation also to use the European health data space. Because again, we know that at member states level, the data available, but also the overview of the data we have is incredibly scattered. There's not such a thing as an overview at EU level. And I think the European health data space intends and holds the promise of gathering data indeed for larger areas. I think it's very much about the interoperability of systems. It's fostering advancements in healthcare innovation, research and policy making. And I think therefore the European health data space, in my opinion, has the potential to improve surveillance and research. And therefore also that will lead to a better approach when it comes to prevention and care. I think in light of time, I keep it short, but I think it leads me to a really important point that I would like to stress, and that it comes down to our first recommendations about the role of presidencies and political will. Because I think in this current cycle, and we're approaching the end of it, as we all know, it's very important that, of course, the Spanish presidency not only indeed push for their high-level recommendation and declaration on HIV, but also push for the negotiations on the European health data space to come to a successful end. Because I'm really afraid indeed that if we wouldn't have the agreement and the end of this mandate, one needs to start at a new mandate and potential delays. And I think on a lot of areas, I think it goes also for the pharmaceutical strategy, Cyrus, that you mentioned, but also on the European health data space, I see the need for swift implementation as very important. And I think that also then comes to the fact that we know that the Belgian presidency, and I talked to them yesterday at an important stakeholder meeting that I organized, may not want to focus per se on HIV because they have a very full agenda. But I think there are areas, and I think prevention is one of them, but equally the European health data space is one of them, where we as stakeholders could and should illustrate why it's so important to advance on these files. Because again, also on HIV, if we have more data, it will lead to a more targeted approach of people with living with HIV, and I think that is very important.
Can I just
Of
add
course,
something
yes.
to that? Because I think, again, I fully acknowledge the gaps in prevention around and we spoke about women. I didn't go in details, but just to, and I mentioned vaguely the regulatory framework that pharma needs to operate if you think about registration of new drugs and registration of trials. So, we currently, again, we do have studies ongoing in women specifically, like big studies of 6,000 people. But the endpoint that is required for us to have a drug approved for women, it's protection, it's efficacy. It's not. We know that it might work, but so the EMA would not accept anything different than that. And we need to go to settings that they have a high incidence of HIV to have this assessment. So that's why we have studies. These studies are ongoing in Africa because we have a higher incidence. We are very fortunate that actually in Europe, the incidence in women is not as high as we see in other settings. Although the unmet need is still there, we don't deny it. What we do plan to do, though, is that we're going to have an implementation study that is not focused on efficacy, which is kind of very hard. We would need to have like hundreds of people, and it would take a long time to prove, to go to more acceptance and adherence and how that plays out in the real world. So, but again, there are things that, from a political standpoint, it could be quite important to have how regulators can be influenced to. Is it all about efficacy really all the time, or sometimes you need to look into other markers? Because we know that for treatment, we know that the drugs work, but sometimes it's the nuances of quality of life and things that are harder to understand the impact or the implication, so to speak. On that front, I mean, I'll go to another comment that Carlos made earlier on around why don't we have the on-demand or event-driven prevention. And again, that goes back to the regulatory framework that we have, because the study that assessed that strategy, that is Hypergate, was not a study conducted by Gilead. So we don't have the data set to give to EMA to support their decision or that recommendation. So, and that makes it a lot harder for us. We have no doubt, I mean, as again, I cannot say that Gilead will support it because it's not as part of our label, but that it definitely supports it. But it's harder for us to change that approach. So, but again, we full on take your comments here, and part of changing policy, and I think we do count on all of you to help influence it anyway.
Great, thank you very much for your input on that. And I'm going to give the opportunity to anyone in the room or online who would like to pose a question to any of our speakers. We have, I think, a question here. Yes. Okay. We have a question here, and we also have a question that's just come in online, but I'll hand the floor over to you.
Thank you. So first of all, I'm introducing myself. I'm Serena. I'm representing HIV Outcomes. It's a multi-stakeholder initiative bringing at the table patient representatives, clinicians, researchers, as well as industry. So I was very happy to hear today that one of your recommendations is to work together, because we could see to what extent it's so important that we bring all these important stakeholders at the table to advance and to see how we can end the HIV epidemic, and if we are to meet. I'm happy to have a policymaker here in the room, so thank you for making it in person. And I have a question for you. How do you think that now we have, with the new parliament, we'll have a new dynamic in the parliament and also in the commission? How do you think that we can all work together towards ending HIV? And how do you think that having this multi-stakeholder approach, having all the stakeholders at the table, could help member states also engage with the stakeholders at the local level? Because we had, I know back in the days, there was the commission who had the action plans, and then which stopped. And I know there was a big push from the parliament to continue with those action plans. And what are your views? Thank you.
Interesting question. As I said, the time is interesting one, because the European elections next year, but not only. I think if you look at the world in general, next year is an important year. European elections, UK elections, American elections, and the realities that we are facing in Europe and the discussions, the narratives that are pushed here in Europe are the same ones being pushed in the UK, in America, by the different actors in those countries. if you see the current polls for the European elections, it wouldn't be that much encouraging to think that we could move much stronger and faster maybe in the next mandate. But hope is the last to die. I think that we need to work on, I mean, this is part of a much bigger discussion in reality, because I see that there is this huge push from the far right, from the anti-gender movement, which attacks the LGBTIQ community, women, refugees, and which is very well organized, very well funded, and so strong on social media. And I think that maybe not to discuss HIV specifically, but in the broader terms, last week I participated in a conference by the trade unions of Finland that had this very good conference on pushing back the far right now that the elections are coming. And I focus on the anti-gender movement because it's this movement that does not want a comprehensive sexuality education policy, that does not want comprehensive sexuality policies, that does not want equality policies, that does not want to inject more money into funding for research and innovation when it comes to HIV, for instance, or other STIs or other issues related to women specifically, or else minorities specifically. And this is the reality we're facing at the moment. So I think that we need to unite ourselves on the other side of the narrative. Sometimes we're called, or at least I am called, woke, or so many other things. But in reality, we're facing society has changed. And I think that we need to really make sure that we stand united together. Those of us who believe in liberal democracies and progressive policies, in order to make sure that our voice is still strong. Because from the feedback I'm getting, and maybe being a politician, you end up, my job is to meet people all the time, especially with our electoral system back home. You need to knock on doors, meet people in the streets all the time. And there is a shift, and it's being seen. And there's going to be a huge backsliding when it comes to equality and rights in general. We've seen it in Hungary. We've seen it in Poland. Now, thankfully, there has been a change in direction over there, but we're seeing it happen everywhere. So we really need to be strong on that. And I think organizations, civil society, NGOs, and others need to be quite strong and firm in this moment from now leading up to the elections. We receive a lot of manifestos from different NGOs and different organizations. I think this is the time to be very strong, and to make sure that the different political groups, I'll speak at European level now, maybe not the UK and the US, the different political groups here in Brussels and at European level give their commitment from now on a number of things. And then we need to hold them accountable. I will not be running myself again. So I'll be joining the civil society and the activists in making sure that this commitment is there by those groups that are not only on the left, but also other ones who always speak of the fact that we need to be strong on equality, but sometimes it sounds just blah, blah, blah. But then when it comes to action, there's nothing. So we really need to be strong now and make our demands strongly. I need to apologize because I will need to leave very soon because I have another meeting in Parliament. But thank you for this amazing opportunity, and let's keep the discussion going. My office is always open.
Thank you very, very much. Thank you for your question also. And I think this leads to, because we are coming to the end, to wrap up the discussion and to touch on that point. Someone mentioned that we have heard from like-minded people this morning on the need to push towards ending the epidemic, but without political will, it becomes harder and harder to do so. And now is the time, with the elections approaching in May and with the new Commission mandate, really need to use this time to push for the recommendations that we have set forward, for the other things that people have touched on today, and to make sure that they remain on the political agenda, not just between now and the elections, but between now and 2023. So I think as a next step, that's what I think each of us should try and do, because political will is of utmost importance when it comes to ending the HIV epidemic and meeting those sustainable development goals. So with that, I would like to thank everyone who contributed to this morning's discussion, those who joined us both in the room and online. Also to those who were involved in the project as well, who give their input at various levels, to Gilead, our partners as well for this project. And I look forward to discussing this more and to continuing the work on HIV. So thank you very much, and have a lovely afternoon all.
Thank you all. Bye. See you next time.
Thank you very much.
Thank you also from Cologne and EATG.
Thanks so much, Harriet. Thank you for being here. Thank you.